1 in 70 boys and 1 in 110 girls are diagnosed with autism every year. Autism spectrum disorder, or ASD, is a lifelong condition that affects a person's social, physical, and mental development. The definite cause of ASD is still unknown. There is evidence supporting a genetic link as well as a controversial theory that childhood vaccines are to blame. Although the cause of ASD is an ongoing debate, the vast majority of families dealing with the disorder agree that consistent therapy is key to continual development. There are vast therapies available for ASD sufferers, ranging from simple speech therapy to intense visual, audio, and occupational therapy. One aspect of overall therapeutic practices that is growing in popularity is strict diet and supplement intake. Research shows that people with ASD who practice gluten and casein-free diets respond better to therapies, suffer less from digestion and skin problems, and are able to gain more meaningful verbal skills. There are other symptoms associated with autism other than mental retardation. A child diagnosed with ASD almost always has gastrointestinal issues, celiac disease, leaky gut syndrome, and mild to severe skin irritation, rashes, and skin flaking. The U.S. National Library of Medicine also states that nutritional absorption is a chronic problem in children with autism, and leaky gut syndrome prevents the person suffering from ASD from absorbing vital minerals and vitamins usually obtained from everyday food or bodily production. Converse states that special diets and supplements for children with issues such as autism are becoming more popular, and some doctors even suggest adding digestive enzymes and supplements to the children's everyday diets. Some examples are vitamin B1, which fights stress and metabolizes sugar, vitamin B3, which reduces inflammation, vitamin B12, which supplements the missing digestive enzymes usually made by the body, melatonin, which helps maintain sleep rhythms, magnesium, which lowers blood pressure, folic acid, which is required to produce all the B vitamins, and calcium, which is important for regulation of impulses in the nervous system. A number of children and adults with autism have experienced relief from GI tract problems and autistic symptoms by removing gluten and casein from their diets. Converse states that as many as 40% of children with autism have been put on a GFCF diet by their doctors in the past 10 years. Removing gluten and casein can result in improvements in both behavioral and physical symptoms. This chart shows some of the items that should be avoided while on the GFCF diet. Things such as wheat, including durum and bulgur, oats, rye, barley, millet, kamut, spelt, most breads, pastas, cereals, cookies, and crackers, most vinegars, many sauces and soups, artificial colorings, artificial flavorings, pre-ground spices, and Play-Doh are all foods that contain gluten that should be omitted from the diet. Foods containing casein that need to be omitted are butter, sour cream, yogurt, ice cream, some margarines, soy cheese, hot dogs, and other processed meats, cows, goats, sheep, and human breast milk, as well as chapstick. Because allergies are so rampant these days, it's easier now to see by reading ingredient labels if products contain gluten. However, casein's still a little trickier. The safest thing to do is to avoid all types of animal dairy and to avoid anything containing rennet. Although Play-Doh and chapstick are not considered food items, small children love to put things in their mouths. Because the main ingredient in Play-Doh is flour, and most chapsticks contain rennet, they should be avoided completely. The U.S. National Library of Medicine states that the GFCF diet has shown positive effects in the ability to learn new material, retention of information, self-care, sleep-wake cycles, bowel and bladder function, clumsiness, social interests, aggression, self-injury, and distress to loud noises. Every year, more children are diagnosed with ASD. While constant research is being conducted to narrow down the cause, so far nothing has been discovered that can be done to reduce the risk of a diagnosis. For now, it is still considered to be a random disorder that can affect all races in all parts of the world. Where research has succeeded in the development of more therapies and organizations that are dedicated to assisting children with autism to become high-functioning as possible, and possibly someday finding a cure for ASD altogether. Research shows that people with ASD who practice a gluten and casein-free diet respond better to therapies, suffer less from digestion and skin problems, and are able to gain more meaningful verbal skills. The GFCF diet, as well as daily supplement intake, is pertinent in the development of children with ASD. The GFCF diet allows the brain to be more responsive to the child's specific therapeutic needs, as well as relaxes the child's autistic anxieties, heals the intestinal tract, and allows the child to live more comfortably. This concludes my presentation on the gluten-free, casein-free diet, and I'll now do my question and answer session.
Okay. What kind of grain substitutes can be used in a GFCF diet?
Because gluten has become such a rampant allergy, food producers are now making many kinds of breads, pastas, crackers, and other things that used to be made out of grain out of rice flour, as well as minimally processed soy flour.
Why is not okay for someone with a GFCF diet to eat soy cheese when they can have other type of soy products?
Cheese needs an ingredient called rennet in order to become a solid. Rennet is found in casein, and so many times soy cheese contains trace amounts of casein. Although vegetable rennet is available, they are much more expensive than animal rennet and are often not used. It's safe to avoid soy cheese altogether.
And how does healing and treating leaky gut syndrome affect the brain for someone with ASD?
When toxins leak out of the gut, they enter the bloodstream, travel through the bloodstream and into the brain. By treating leaky gut syndrome, the amount of toxins released is minimized, which allows the brain of the person with ASD to be more responsive to their therapy program.